Hello, welcome back to the channel, and this is part 2 of science behind increasing flexibility, and today I will explain all the drills and my journey to side splits. The drills I'm about to show you are not only for those of you who have side splits in mind. If you're generally leading a sedentary lifestyle and you feel a lot of stiffness around the hips, a lot of tightness through the hamstrings, hip flexors, groin, if you feel that you're restricted when you're running or cycling or doing any other daily activities, a lot of drills, especially the first level drills, you may find them very useful, very helpful in overcoming gripping around the hips, maybe just creating a bit more sort of feeling of space and freedom in the joint. I've covered all necessary theory, principles, concepts in a previous video. So part 1, science behind increasing flexibility, where I explain everything about my journey to achieving front splits. This will be definitely key so you understand why we're going through certain positions, how we creating contractions, when we relax, when we progress, when we breathe, and so on. So today we'll be expanding this repertoire and talking about side splits, which again is much harder position to go into, primarily because most of our life we spend in flexion extension, sort of working in sagittal plane, and we're not really spending as much time or training abduction. I got into side splits like I really brought my pelvis to the floor all the way in my late 20s. In my 20s, early 20s, I could not really get all the way down. I felt like my hips were pinching. I felt a lot of discomfort in the outer sides of my hips, and I know this is a common problem for a lot of flexible people. I've been in yoga world for quite a long time to see there was a lot of passive stretching going on. There was a lot of pushing through discomfort, pushing through pain. I don't really train yoga anymore. I really work on my mobility and flexibility in slightly different ways, more specific ways to what I want to achieve. Don't expect that suddenly overnight you will be able to do side splits. No one can promise you this, okay? I know there are a lot of short form videos out there with clickbaity titles and promising quick results and like do this one magic thing. There's no such thing. We all have the same physiology and neurology, maybe slightly different structure, but anatomy really in general is the same. So don't believe those empty promises. Changing physiology, guiding physiological change and adaptation takes time. So be patient. I warn you right at the start. And again, like with everything, if you're quite close and you're trying to just push it, ask yourself why you're going for this position, and also consider, is it the right time to be doing this? If you're hypermobile, pushing positions like side splits and front splits or any other bendy movements may not necessarily be advisable for you. Remember, guys, that we don't want to rush, because we certainly want this journey to be, first of all, sustainable, enjoyable, and also to yield results. Last thing we need is a muscle strain. The adaptation takes time. Force is the language of cells, so you can only really create change through time under tension and also progressive overload of the tissue. So we want to slowly start loading the positions, start loading the tissues in the positions we want to achieve. Doing it gradually, taking our time. Therefore, consistency, like I always say, is the key. And this is how, through force, targeted, specific, this is how you guide, direct, and create change in your bones, through loading them, muscles, through stressing them, ligaments, tendon, fascia, connective tissue. Directionality matters, okay? And also time. Specific and consistent inputs with progressive overload. I just want to make one thing clear. Your tissues do not respond to your sheer will of improving flexibility. They don't respond to someone screaming louder at you. They don't really respond as well to someone just pushing you into position, or you pulling yourself into the position, or loading more plates to push yourself into the position. You most likely creating more damage. You're working against yourself. So remember that time under tension, correct breathing, okay, relaxing into the position, and then gradually starting to create inputs, contractions of the tissues you want to lengthen is the way to go. So again, check out the previous video, learn about the CRIC method, understand what's happening with the reflexes so you can actually take control of your body. Again, if there was a quick and easy solution to improving flexibility and mobility, most of the people walking on the surface of this earth would be close to a level of the Cirque du Soleil athlete. And that's not the case, right? The things we see in clinic are usually injuries related to inactivity, poor biomechanics, overuse as well, and also result of adaptations due to compensations after an injury. So there's a lot of undoing to be done first. Remember that stiffness primarily results from inactivity and also lack of tolerance of our connective tissues to higher levels of tension. So if you never do the hamstring stretches, then of course, if your knee never crosses 90 degrees, right? If you're always there with the knee bent or slightly bent because you're sitting, you're driving a car, you're walking, you're cycling, you're running, you're kind of always going through the same motions where the hamstrings are usually quite shortened. Don't expect that suddenly you will do a few stretches, you hold for 30 seconds, a few times, and suddenly you'll be able to touch your toes. You see what I mean? There will be response from neurological response. There will be response or alarms, signals raised to protect your tissues from injury. Therefore, there will be contraction of those tissues taking place. So knowing that neurology is frequently what's standing in the way, or lack of exposure to certain position is what's in your way, then let's start getting into the ranges of motion or improving ranges of motion that are required to get into the positions you're trying to achieve. So take your time, build it slowly, gradually, sustainably, commit to regular work, and you will see that this will work long term. Coming back to actual journey to side split, I've divided the process into specific steps. We're going to start working from the foundation, so from actual hip capsule, our ligaments that hold femur in the socket, right? That's where we want to start, because most of the movement, or if not all movements of the hip, require some level of gliding, capsule movement and rotation. So that's what we will tackle first. We're thinking of improving hip internal rotation and hip external rotation, and those are the drills I would recommend starting with. All right, guys, we've arrived to the drills. Step 1, we're increasing range of motion in hip rotation. Let's start with internal hip rotation. So if you see the position, I'm in the 90-90. And guys, this is a great position to open up posterior capsule. We'll be stretching here the group of the deep hip muscles called external rotators. These create like a rotator cuff of the hip joint. So they provide stability for the hip joint, but also determine how far the femur can move in the acetabulum in the hip socket. We are looking to stay in this position for no less than 2 minutes initially. And if this feels slightly uncomfortable for your knee, slide a cushion below the knee or lean further back. There are plenty of variations for this, but I'm not going to be diving into that topic specifically today. Guys, after 2-minute hold, you would proceed then to CRIC method, which means we're contracting the tissue on stretch, which will be posterior hip capsule and external rotators. So we're pushing the foot down into the ground, 10 seconds, 20% of your max strength. After this, reverse this, contract the antagonist, which means we're trying to contract internal rotators, which means you're trying to now push the knee down and lift the foot off the floor, or think of making your foot light. So in this case, you will be pushing up into the block. After 10 seconds, and you're trying to turn your torso and your pelvis towards that block, towards that internal rotated leg to increase that internal rotation in the hip. You would repeat that 3 times, and that's the drill. And here's the modification. You're simply leaning further back and you're turning away from the internally rotated leg, or you can progress by going into half 90. So it means that one leg is straight. this may be a bit confusing. Rotation is indeed a bit confusing in terms of directions, but maybe I will dive into this topic a little bit more in the future videos. Let's move on to the external rotation. Okay, so we're going to do the opposite. We'll be going into so-called pigeon. Okay, I'm just going to show you the passive position first. So guys, look at the angles. You see my front knee. I'm looking at close to 90 degrees, maybe 80 degrees. And I'm also pulling the toes up to the kneecap for dorsiflexion. The positioning and the height of how high your pelvis is, how high your knee is really important, because you want to have your pelvis square and you need to make sure that your knee is not suffering, okay, either laterally or medially. So using cushions and blocks and some support is definitely helpful. Now, full pigeon will be, of course, with the back leg extended if your hip flexors allow you to go that far. So guys, pigeon does really opposite of 90-90. We are really getting to the anterior part of the hip capsule, even though the stretch may be perceived in the fleshy area of your bottom. Guys, step 2 is now working on flexibility of your hamstrings and glutes. And please, for this, refer to the part 1 where I covered everything important to achieving side splits as well. Without those steps, without those drills, you will actually encounter most likely a lot of resistance in progressing to side splits. Now, step 3 is actually working on hip abduction, improving hip abduction and increasing flexibility of your hip adductors. Again, I say increasing flexibility, but work on flexibility also requires some level of contracting. So we're going to start working with unilateral drills, which involve one leg in neutral, one leg abducted, and then bilateral drills, which is again a step up. Get ready to start working with those positions. So then you can finally start tackling and playing around with position and position of the pelvis. Once you're able to rotate your hips in abducted position, side splits will prove to be much more accessible. Let's start with more accessible drills, unilateral drills. This is going to be open half kneeling. So guys, this is how we set up. From high kneeling, you basically abduct one leg. You want the kneecap to track over the middle of your foot, so we're not straining knee ligaments. Tissue on stretch will be your groin and your adductor area, and the tissue, the antagonist, will be your abductors, which will be like a side of your pelvis. So CR, we're contracting the muscle on stretch. So you're pushing your leg into the arm with 10-15% of your max strength. And then as a following, you will be moving the knee away from the arm, contracting your abductors, trying to send the leg further to the wall behind you. You will repeat that 3 times. Because again, this position will really make your legs very, very tired. And bear in mind, again, we don't really spend that much time in abducted position, so you may even sense a little bit of shaking going on. And second unilateral drill, it's going to be a one-sided side split basic. So like I mentioned, for side splits, we need to learn how to rotate the hip in abducted position. So we will be applying adductor stretch. It's only one leg, so it's much more bearable and accessible for many people as an early drill. Again, rotate internally, try to bring the big toe to the floor, lift your pelvis if necessary. This position needs to be sustainable, so you can stretch and hold it for a couple of minutes. After that time, under tension, we're starting our CR method, doing the contracting of the stretched muscle. So you will be pushing foot, inner heel, and big toe into the ground. 10 seconds, 10-15% of max strength. And repeat that 3 times. After every drill, progressing into slightly deeper stretch if you can. You can progress also in terms of positioning, bringing a block below the foot or placing the foot on the sofa. And guys, this is all about not only just flexibility, it's also about developing control over the muscle and over the position. So here's the drill from my first video, or you can do this progression I was working on this summer and have the foot much higher. If your hips allow you to go a little bit deeper, you can do this single leg squat variation and work towards a little bit more abduction this way, killing 2 birds with 1 stone. And guys, as an antagonist, we want to also strengthen hip abductors, abductors, which is the lateral part of the hip. In this position, again, it can be pretty challenging, in fact, but try doing a straight leg liftoffs in hip abduction. Now, be mindful you do not want to move your lower back or tilt your pelvis too much. You, in fact, want to irradiate and stiffen your trunk and arms and back, and really just work on hip itself. This is the position of the hip you need to get stronger in order to successfully achieve side splits. For more drills to improve hip abduction, click the link above. And now moving on to the bilateral work. So guys, we're getting closer and closer to our end goal. This is frog, which again takes time to build. Okay, lots of people, like I said, are very weak and stiff through the groin area. So you can start in a child's pose, do a little bit of shifting forwards and back. Look how my feet are much closer together, and just start there. Progression will be to send your feet further apart so it actually looks more like a frog position. Be mindful of any compensations from the lower back. We do not want to arch the lower back, go into hyperlordosis. You want to stay in this position for no less than 2 minutes. So use blocks and cushions to support your ribs and pelvis. And here, guys, we play by the same rules. In order to improve that position or get stronger in this position, we will be contracting bilaterally through the adductor muscles. So we're kind of squeezing the ground, pressing knees down and trying to bring legs back together. 10 seconds. And then relaxing, going into the deeper stretch 3 times. All right, guys, final steps. Pancake, or straddle stretch. We are looking to pull ourselves into a pancake and then push ourselves out of it. So this is more kinetic stretching rather than just passive stretching. We're trying to tilt pelvis forward. So this is your hip flexion combined with abductions. We're actually pushing feet out, pulling yourself into position. And then pushing out by pressing feet down into the earth and tucking tailbone under to return. So you see that it's a pelvic motion combined with a bit of activation of the hip muscles. Again, do it slowly, control. And for further explanation, let me know in the comments. Okay, and finally, we are approaching side splits. So guys, you can obviously use this sort of standing straddle position and start holding the position, maybe hands on the blocks, trying to get those legs out. At this point, you should be prepared for hip abduction and rotating in the position. Now is just the case of actually combining both legs, right? Inner thighs on both sides, and pelvic floor and hamstrings and abductors and adductors together. So you're looking at getting yourself into deepest pancake, and then adding your CR and CRAC method. So again, pushing feet down into the earth like you're trying to bring them together, and then squeezing the glutes and sending legs backwards, trying to ultimately pull yourself deeper into the position. So you see that this is my first kind of release into deeper position, first progression after the first drill. And I'm going to repeat the same thing, squeezing the earth, contracting inner thighs, and then squeezing the glutes, separating the feet even more, contracting through the back of the pelvis, and then relaxing into yet deeper stretch. So this is my way. I mean, the method is exactly the same, no matter what stretch you're doing, right? It's just a matter of execution. Do you see how I'm tilting forwards? I'm actually, getting those big toes to the ground. And that is the sort of final step where that feeling of stretch will be quite intense. So you need to build up to it. Otherwise, you will end up with a strain or discomfort, or obviously you don't want to pull a muscle. You see how bringing myself back to a vertical position with my toes turning to the floor is, to be honest, the hardest bit. This requires hip abduction and internal rotation at once, and a lot of flexibility through the inner thighs and pelvic floor. Good luck with your progress. That's it. All right, guys, that was quite lengthy. I hope you found this valuable. Please give it a like, give it a follow, share with someone who may benefit. And thanks for watching. And again, I still recommend you start working on strength of your adductor muscles. This will also be quite valuable, considering that those are really undertrained muscles.